Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a tarsal coalition. Tarsal coalition is a union of the tarsal bones in an area that shouldn't be connected. So instead of having a joint in an area, you can actually have a connection that's not supposed to be there. So let me give you a little bit of help understanding exactly what the tarsal bones are. So the tarsal bones include the calcaneus, the talus, the cuboid, and the navicular, and then the cuneiforms. Those are all tarsal bones. So cuneiforms are the three right here: cuboid, navicular, talus, calcaneus. So the idea is these are the tarsal bones, and you can actually get an abnormal union between some of those bones. It can be a fibrous union, just a soft tissue union. It could be a cartilaginous union, or it could be an osseous union, or sometimes called a bridge, where it connects those areas. The most common that we see on X-ray would be the calcaneal-navicular union, where you actually see the navicular and the calcaneus coming together. On CT and MRI, however, it may be either the calcaneal-cuboid or the calcaneal-talar union. So getting connection between the talus and the calcaneus, or the calcaneus and the cuboid. But like I said, the most common I've seen, I typically will see the calcaneal-navicular. And why is this a problem? Symptoms of a tarsal coalition, they can cause pain. If they don't cause pain, we don't worry about them. But they can cause pain. They can cause limping, where they have a problem walking. They can cause a very, very stiff joint. So if you were to look at this and you say, okay, I've got the subtalar joint that's supposed to be able to move here, but we connect it to the navicular, we take away the subtalar joint motion, and you end up getting arthritis or pain other places because you don't have the normal motion that you need. You can have a flat foot, or you can have actually a rigid arch foot, depending on how the tarsal coalition is forming. So what are your treatment options? Basically, for a tarsal coalition, you can do anti-inflammatories like non-steroidal anti-inflammatory medications, such things as ibuprofen or aspirin, to try to decrease the inflammation in the area. You can actually do injections, steroid injections to the area. You're not fixing the tarsal coalition, you're decreasing the symptoms. You're taking away the joint inflammation and the pain, and you're actually injecting to the location that has pain. You can do orthotics or specialized bracing to minimize the motion, which takes away the pain. A good orthotic that supports the foot and actually reduces the need for motion in the subtalar joint, for example, could help. You can actually put them in a boot for a short period of time, a cast boot or something like that, to try to alleviate the symptoms, so forth. Most of the time, if you're having pain, though, you are going to need to go in and get it surgically corrected. The best way to do that is to literally go in and you cut the coalition out, and usually the way we will typically do it is we'll put something between it. So we use some soft tissue or something so that the bones can't grow back together, so they don't heal. So tarsal coalitions typically occur from birth. They usually don't notice it as a problem until there's enough bone formation, and a lot of times they're diagnosed in children, but they may not be diagnosed until adults. It just depends on when they become symptomatic. So the estimation is that 1 in every 100 individuals will have some form of tarsal coalition. So they are quite common. They are not real common that they need to get surgery. So it could be higher than that. It just depends on when their symptoms are presenting. So I do see these, I do treat them. I do recommend that if you're having pain and your foot feels really, really stiff and you have constantly limping and so forth, that you get evaluated. On X-ray, they can a lot of times see a tarsal coalition. Otherwise, if they're not sure, they can actually do CT or MRI, depending on what type of coalition it could be. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 73, Tarsal Coalition.